Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. And today we decided to continue the disease, and we'll take up HIV. Very good. At one time it was such a pandemic.
Yes, still like 1980, we never heard of this type anything. Suddenly in 81, 82, it started emerging. So initially, the funniest part of this HIV, it's the name, full form itself suggests the pathogenesis. It is a human immunodeficiency virus.
Human
Immunodeficiency
immunodeficiency
virus.
HIV, yes.
See, in this virus, once it gets entry into our body, it starts multiplying. And it continues to multiplying without much symptoms. And initially there would be very trivial symptom like feverish feeling or toxic feeling and all, and it would recover by itself. And then later on it continues to multiply, but asymptomatic, absolutely no symptoms would be there. And this may continue even for years. Means on an average, we have seen that it used to take 8 to 9 years to develop symptoms. And it would multiply. And then it would become apparent at such a phase that it won't reverse. And it would be unmanageable.
I have seen faces just pockmarked with
They will just get emaciated and they just become, just skeletons. We have seen. And till 1985, 86, everyone was confused. Even medical fraternity did not know. This just emerged out of blue. And people just started dying, and not dying immediately. They would just emaciate and suffer and then die. And before that, they were transmitting this infection to so many.
But it was sexually transmitted.
Fortunately, it requires a very close contact, mucus, like all venereal diseases. So it's very intimate contact or blood transfusion and all that through the serum
Usual
contact.
yes,
Usual.
yes.
Even with the needles also, same needles if people are using. Actually, from that the concept of disposable needle came. Till then they were just keeping boiling water and just sterilize for a minute and then reuse the same needle. But it's because of the incidence of HIV the disposable needle started. And we have seen somewhere like in 1990, 95, it became like an epidemic. Because one doesn't know who is carrying it. And therefore, one infected person would go on infecting so many people, especially the sex workers. It used to be like and so silent that even the patient, relatives, even doctors won't know like what is happening. And presentation used to be altogether different in patient depending upon own immunity. Because what happens in HIV, the virus goes on multiplying, and once it attains the position, then starts attacking the vital area, and then the symptoms start coming. And it's mainly it attacks the reticuloendothelial system, which is a immune system. So the T cells get affected. So the CD4 count, CD4, actually this is the element where the infections are controlled, that depletes so much that it depletes 500 and 2500 is normal, but it can deplete up to even 50, 60. And that time we call it a full-blown AIDS get developed. So HIV, after 8-10 years of multiplication, the person lands up in full-blown AIDS phase.
Was it mainly male-male or male-female or
No,
both?
both. No discrimination like that.
Okay.
And funniest part is in this, like in gonorrhea and syphilis, we get at least primary symptoms. Especially gonorrhea, we get primary
Yes.
symptoms.
Yes.
In HIV, nothing like that. Person doesn't exhibit anything like a little bit of fever, imperceptible symptoms come in infective phase, and then it goes on multiplying for years together. And once it multiplies to that extent, then it starts exhibiting. Means here the immune system starts failing, and then the symptoms come. And the symptoms are like all opportunistic infections start thriving,
Ah,
even ordinary tumors start growing, then even many types of cancers get developed because immunity is compromised. All these things come up, and therefore the CD4 CD8 count also gets distorted. It actually it should be 1 or above. CD4 CD8 count proportion should be like this, and it starts depleting, and therefore person starts developing some rashes on the body, fever, loose motion, even cancers get developed, even tuberculosis, also uncontrolled tuberculosis. And it is here the medical fraternity started recognize the own immunity of the person. Earlier, doctors were proud of antibiotics. They said any infection can be controlled with antibiotics. It's the inception of this HIV phenomena. Doctors started realizing that antibiotics are not enough. Once immunity is compromised, the person will not respond to antibiotics at all. And for years together, people went on dying and nothing could be done. Initially, so there was so much confusion about transmission and all that if the patient, like we have seen in very popular corporate hospitals in Bombay, one patient after death or near, in terminal illness, they diagnosed it as full blown AIDS and HIV. Till then, the whole bed, the room was sterilized, and everyone who just went in the room for a while, they also started testing themselves for HIV. Means so much care was there in that. And at the same time, many doctors who are not aware of this routine, what we call cesarean section or routine surgeries they used to conduct in hospital. I know my very good friend who is popular surgeon in Maharashtra. He used to conduct cesarean of surgeries or hysterectomy surgeries, and during surgery, while putting sutures, invariably they get injured. And then after few weeks, he realized that the person was full blown case of AIDS, and he also tested HIV positive, and nothing could be done. He just passed away in that. It was initial phase. Later, this ART, antiretroviral therapies came, and then these therapies were able to arrest the multiplication of HIV. They could just arrest multiplication. Person would never be devoid of HIV, but at least the multiplication will stop, and once the multiplication stops, the transmissibility also comes down. So the transmission also can be checked if the person is treated promptly. So here we have to identify the person and then again put restrictions so that at least it is not transmitted.
was there improvement in the health?
Yes. And 19, yeah, general health, the person doesn't see. HIV itself will not cause any harm to the person. The HIV just attacks your immunity, and immunity gets compromised, and therefore the person starts getting other illnesses. So HIV itself will not cause any illness, but it just ruins your immunity. And that is why when it is in the final phase, we call it full blown AIDS. AIDS is acquired immunocompromise syndrome. So it is acquired immunocompromised disease. So immunodeficiency syndrome, we call it. That's why we don't call it disease, we call it syndrome. So here what happens, once the person gets full-blown AIDS, there the symptoms would vary, because whatever is opportunist, you say, like we eat some rotten food, marginally some organisms which are otherwise normal in food will not affect normal person, but this immunocompromised person will start developing loose motion, he will start developing rashes and emaciate, and then just deteriorate, and then finally there would be death. So it was like a great scare in India. We have seen that not only in India, all over the world.
All over, true.
And we have seen people coming down with that illness. But we have seen very funny aspect also. I have experienced that, first of all, patients never used to realize, they never used to even share their exposure to unsafe sex, and therefore they never used to divulge these phenomena, and even doctors fail to suspect it. So now they made it mandatory for every patient to test. So like someone is going for surgery or blood transfusion, they will test HIV. Even for every blood transfusion, without testing for HIV, they now transfusion is not done. After the, I think 1988 onwards, this started. All blood banks, it is mandatory that each blood sample has to be tested for HIV, and then only it has to be cleared for transfusion. Otherwise, we have seen these thalassemia major cases in all children becoming HIV patient because of contaminated blood transfusion. So this was very common. Very funny phenomena we have observed, like, because as a homeopath, we used to get these cases for treatment. And here we used to tell that finally it is your own immunity. Somewhere body will be able to develop antibodies. Body develops antibodies. Finally, this ELISA test or Western blot test, they all detect antibodies. Problem with is this antibody formation is not enough to arrest the multiplication of virus. Our human body itself doesn't have the capacity. They produce antibodies, they respond to the virus, but the multiplication is so much gallopingly advancing that it can't be controlled by these antibodies by itself unless there is external aid. And therefore we hypothetically used to tell patient that till your system becomes so efficient that the virus multiplication gets arrested completely, till then you have to see that you don't go into getting opportunistic infection. So you don't go in crowd, because otherwise in crowd people emitting out some organisms, ordinarily the person will not suffer, but this person will be susceptible. So we used to tell, don't eat stale food, drink ample of water. Even the water which you drink should be safe and potable water for drinking. Then don't go in crowd, or at least go with a mask if at all you have to go. And then don't get exposed to harsh weather conditions where again your immunity gets compromised. With all these precautions we were managing, and somehow we were finding a good success in this.
I did want to ask you about allopathic, Ayurvedic, and homeopathic, if you could address those three things.
See, allopathically, they started applying these antiretroviral therapies. And those therapies also used to be tailor-made depending upon the person's own immunity level. And again, a lot of side effects also used to be there with this, but they started getting success. The best part we have observed is, we can call it herd immunity or something like that, but then people started responding to those therapies and they started sustaining. And we have wonderful cases here, like one person, and they were keeping confidential. As a medical ethics also, people were counseling everyone, but they used to keep it confidential, because otherwise patients whole community used to just abandon them, isolate them,
In India,
boycott them,
especially, I would think.
boycott them.
Yes.
So here we had a doctor himself. He was just interning. He just passed out from medical college and he was completing his internship, and that time he was detected to have developed HIV, and almost like full blown case, means he was becoming susceptible to diarrhea. But we did not declare him to be full blown case because he did not have that severe symptoms. But he was confirmed. He used to get twitchings and neurological symptoms and lose motion and fever and all those criteria, and it was confirmed. And he got herpes zoster infection, which was not getting under control. In normal course, herpes zoster is just like a self-limiting disease. It will have symptoms for a while and disappear. But in his case, herpes zoster was so progressive and aggressively growing, and it took more than 3 weeks, and there we suspected and he was tested positive. And then accordingly he was advised to remain away from the patients. He was advised to take duty where he is not exposed to patients. Then he started working in pharmacology department where he has nothing to do with the patients. Then he took admission for post graduation in pharmacology with the intention that in pharmacology it's like a lab study. He is not exposed to patients. And he was doing wonderfully well. He used to eat proper food, drink plain water, never go in crowd. He never would eat hotel food or unsafe food. And funniest part is, of course, this was not disclosed to the community. He himself knew and his family knew. So he was
Yes,
taking
of
care.
course, yes.
And he was recognized as the ideal medico who is confined to his studies and all. So many marriage proposals came and he was avoiding with some reason. And finally he became lecturer also after completing there. And funniest part was his professor also proposed that his daughter, who again is a medico, that he should get married with her and all. He's very diligently he refused, telling some other reasons, personal reasons. And finally he came to the point where family started imposing. In India, like, parents feel that that is their duty, that their offspring is married in front of them, that means the person is settled. So they all forced, and they brought one proposed one girl for engagement. And then he just told that girl, sorry, I can't convince my parents about this, but somehow I must. Then that girl somehow teased, okay, what is the problem? You tell me what is problem in me that you are rejecting my
Yeah.
proposal. And he shared this. Okay, I am HIV infected person, and that is the reason I don't want to get married. And then she told her parents, and then whole community and everyone started, boycotting the community, whole family. And then he approached us again, what to do. Meanwhile, what had happened, I had suggested him that along with homeopathy, you take some energy therapies. So I referred him for Reiki training.
Oh,
And he went for a Reiki training to get initiated for Reiki 1 to Pune. They organize 1 3 days camp, and they train the participants, and then they initiate. During that training, when he was being trained, and they make partners so that they scan each other. And the person who was trainee person, who was his colleague, told that I'm getting very peculiar sensations, I don't know what it is. And the master who was training the whole lot, she was a grandmaster, she is grandmaster in Reiki, and she scanned him. And then she realized that he has a very peculiar toxic energy influence. And then she phoned me, because in his form for recommendation for training, it was me who had recommended. So she phoned me one junior doctor whom you have referred, his body is full of, they were non-medicals. They did not know that he is a case of HIV infection. And she told me his full body is full of toxins, and it has to be cleaned, by a group of Reiki masters. Then only it can be cleansed. They did not realize that it is HIV, but they realized that there is some deep-rooted toxicity in him.
How did she scan him?
In Reiki, they scan with some distance, keeping like they go close and they read the flow of energy, how the energy is sucked. There, the flow of energy they check. And for 1 hour, the sessions were stopped because the grandmaster who scanned him, she herself needed therapy to recover. So that time I realized that, see, the Reiki scanning has some truth in it. A sensitive person can do it. But there I realized I used to feel, even I was initiated as a Reiki channel. And there the preaching was that you are just a medium for the universal energy. You don't get involved in it. You just become medium and then energy is transmitted through you. But there I realized that you can get affected. It is not that you are safe. So the grandmaster herself, got ill for
Yes.
1 hour
Yes.
with this. Then this person, he studied homeopathy for himself. He attended homeopathic classes with us. And then finally, what happened when it became too much, like, even in job situation where people came to know that he is HIV patient. So then he committed suicide. And unfortunately, what happened, he took job far away from the known people. And there he couldn't approach us. He had no counseling possible around him, and he committed suicide. As against this, one more case we have now. He's a agriculturist himself, and he is like a agriculture movement person, like who takes up all issues of farmers at government level and all. He's a politician type. He also had full-blown AIDS. He had developed tuberculosis, which was not yielding to treatment. But he did very smart thing that he just declared that I am full-blown AIDS case, I am HIV patient. So he used to keep distance, he used to go travel in proper environment in his own car. And he used to take counseling sessions for HIV patients. I'm talking of 94, 95. At that time, once you are HIV means they used to just count days that you are guest for a while. His family, his wife also was tested positive. But he continued with antiretroviral therapy and homeopathy, and again the self-management properly. He is still there wonderfully. He writes on Twitter and still he is in our contact. And then what happened later on, the gravity of this infection became much, much less. Even transmissibility also is less, and the incidence also has come down.
This is worldwide.
Worldwide, people are recovering, and of course people are educated properly. So now people don't boycott. They know only the close contact will talk. Even if we talk to person, it won't be transmitted. It's not a airborne disease or something.
How much do you feel it's herd immunity?
Exactly, that is what I say, that herd immunity has the major role in this.
Okay.
Because initially what happens, bodies develop antibodies because the whole testing is testing antibodies. But those antibodies, quantum was not enough. And now people started developing antibodies, and therefore the antiretroviral therapy as well as the herd immunity, both things have come together. And so now the gravity has come down. The deaths because of HIV are much less now. Much less, not even 1% as compared to that. Otherwise, I have seen that time very rarely people used to sustain for a year or so. Not beyond that. Once they get full-blown AIDS, 1 year is maximum that time. And now there are people who have come out almost 30 years and their CD4 count is wonderful. Their CD4 CD8 count proportion also is good, and they are leading normal life, and even transmissibility is not possible. Of course, people have become aware, so they are taking care that there is no unsafe sexual contacts and all. Plus, even the hospitals are careful for before giving blood transfusion or using needles and all. No, see, it's mainly the awareness also. People have become aware. They have witnessed deaths. You see, it's not like that you have done propaganda and all. All these lorry drivers and all, like in our history, we should take. If you are a truck driver, like being away from family for long, they are more vulnerable for unsafe sexual contacts. So, but they have witnessed their colleagues dying like this, and therefore they also naturally get educated, and one colleague like suffers and goes through, then the message spreads. So definitely people have awareness also is helping, plus herd immunity also has helped.
Oh, this was very thorough. Thank you, sir. Thank you. And namaste all.